For those of you who do not know me, I'm Tamara Scott. I am the Director of Nursing for Home to Stay. I first want to thank you for the quality and safe care that you're providing to our families during this very difficult time. During the pandemic now, as you know, in our community and neighboring communities, our COVID infection rates are doubling and tripling by the thousand each day. It is most important now more than ever that we keep our clients and our families safe. The steps that you can take as a healthcare provider to do this for our patients and families and our own families. First is completing your COVID 19 screening each morning. It's important that you fill that survey out accurately and timely each day and report any adverse symptoms or any symptoms of illness to the agency immediately. Also, keep that in mind when you're providing care for your patients and families. If you notice that your patient or your family member in the home is sick, that's something that you need to report as well. Please make sure that you are donning your PPE as appropriate at all times. For every client, even if the client is not sick, even if you are not sick as a healthcare provider, it is mandatory that you wear your blue surgical mask at all times. You should not be wearing cloth masks from home. You should not be wearing, a bandana or scarf. You should be wearing that blue surgical mask at all times. That mask may only be removed for scheduled meal times, and at that time, you should be at least 6 feet away from the client during that time. A lot of our families have cameras and have witnessed our healthcare providers not wearing masks. Unfortunately, due to the high rates of COVID and agency policies, that is not something that we will tolerate, and that may result in disciplinary action should I get a report that my healthcare providers are not wearing masks. We, as an agency, are encouraging all healthcare providers to be tested at least weekly. Our families are asking for it. All of the facilities are demanding it. As you know, many of the agencies in our community are providing these tests at no cost. You just have to schedule them regularly. I recommend that as healthcare providers, you pick a day each week and schedule your tests for the next week so there is no delay in you providing care and or working for the agency. Many of the facilities, however, that are asking this of our aides are providing the testing. If you have any questions about that, you can speak to, our agency, our HR rep, Andreas, about which facilities are providing the testing and how you may get tested. The other thing is if you have any questions about how to don PPE, our infection control policies, it's really important that you get in for our in services. The in services are each Wednesday and every other Saturday, and that's one-on-one or small groups, maybe with groups less than 5 due to raising COVID rates, where you're working with me on all of our CHHA and companion skills, in addition to the infection control and COVID policy. If at any time you have any questions about your symptoms, your patient's symptoms, or COVID overall, you may feel free to reach out to the office and we will direct you appropriately. As the Director of Nursing for Home to Stay, I am responsible for and happy to provide all of the clinical support that you need for the agency.